Good afternoon, everybody. Thank you for joining us once again. This is Congressman Mike Levin, and this is our 32nd virtual town hall since the middle of March. We're very grateful you're here, whether you're watching on Twitter, Facebook, YouTube, or on our website. Thanks for joining us, and I hope over the next 90 minutes or so, we're going to be providing you some great information, some timely information, both on COVID-19 and other issues of the day. Before we dive in, I wanted to take a couple of minutes to honor the life and legacy of my dear friend and colleague that we lost last night, John Lewis. Chrissy and I were spending some time with the kids when I got the horrible news that John had passed away. And he'd been sick, we knew that, for the past several months fighting pancreatic cancer. But the last time I spoke with John, he was in good spirits. And to this day, the fact that I got to know John Lewis, work with him, befriend him, is surreal. And I'll never forget the trip that Chrissy and I got to take with John and some of my colleagues last year to Selma, Montgomery, Birmingham. We walked across the Edmund Pettus Bridge, arm in arm with John, and it was an unforgettable experience, an unforgettable trip. And we need to rename that bridge after John Lewis. It's the very least we can do. John was a person of incredible courage, integrity, grace, widely known on both sides of the aisle as the conscience of the Congress. And I think if John were listening right now, he'd tell me to keep fighting for what I know to be right: voting rights, equal opportunity, and peace. He'd also want me to fight against what he knew to be wrong: voter suppression, racism, and hatred. And he'd tell me not to be afraid to get in some good trouble, necessary trouble, to keep moving our country and our planet in a positive direction. I'm going to continue for as long as I have the honor to serve in Congress to fight for that shared vision of a better America. And Chrissy and I are going to continue, just as we did last night, to talk to our kids and hopefully someday our grandkids about the life and legacy of this amazing person, my friend John Lewis. As John once put it so well, and I quote, "We used to say that ours is not the struggle of one day, 1 week, or 1 year. Ours is not the struggle of one judicial appointment or presidential term. Ours is the struggle of a lifetime, or maybe even many lifetimes. And each one of us, in every generation, must do our part. And if we believe in the change we seek, then it is easy to commit to doing all we can, because the responsibility is ours alone to build a better society and a more peaceful world." Rest in peace to my dear friend, John Lewis. I got through that. With that, let me introduce our guest this week, and let me turn to some other topics for discussion. For those tuning in for the very first time, we are privileged once again to welcome back Dr. Richard Garfien. Dr. Garfien, in addition to wearing a very cool shirt this week, is an infectious disease epidemiologist, educator, and healthcare innovator who seeks to understand the causes of disease and translate that understanding into impactful solutions. Dr. Garfien earned his PhD at Johns Hopkins University and his MPH at San Diego State University. He served as an epidemic intelligence service officer and epidemiologist for 7 years at the Centers for Disease Control and Prevention before joining the UC San Diego School of Medicine faculty in 2005. Dr. Garfien's research focuses primarily on airborne and bloodborne infections often associated with health disparities in substance use, including tuberculosis, HIV, and viral hepatitis in the U.S. and abroad. His research on digital adherence technology over the last decade informed CDC and WHO guidelines on the use of telehealth for remotely monitoring patients with tuberculosis. Such technology, of course, has great relevance today for COVID-19 monitoring and patient support. And Dr. Garfien, I looked this up, and this is your 13th virtual town hall with us since the middle of March. That is extraordinary. You are amazing. And I'm so grateful for all the information that you provided to our constituents here in the district and everybody else who watches us as well. So thank you again. Next, my dear friend, Mike Young. Thank you for joining us, Mike. Mike is the political and organizing director for the California League of Conservation Voters. He's been with the organization since 2005. Mike's a graduate of Pepperdine University and earned his BAs in political science and philosophy, as well as an undergraduate certificate in dispute resolution. He has extensive experience working with key political and grassroots community partners to build strategic relationships that have helped both identify and support environmental leaders, as well as hold legislators accountable to their community's concerns. Outside of CLCD, Mike also serves as a board member and advisor to the Black Women for Wellness Action Project and LA Forward. Mike, again, is a dear friend. I'm very grateful that he can join us to discuss environmental and energy policy today, and it looks like he's joining us from Hawaii or something. I think that's just a virtual background. But we'll get to Mike in just a second. This week with COVID-19, get Mike's thoughts, and then we'll get to many of your excellent questions this week. With regard to COVID-19, of course, very sadly, our country passed the 139,000 mark of people who've tragically lost their lives as a result of this virus. And they are so much more than just statistics. As we have said many times, these are fathers, mothers, sons and daughters, brothers and sisters, husbands and wives, loved ones. It's just tragic. And the U.S., as we know, has the most confirmed COVID cases in the world, over 3.6 million. And as I mentioned, 139,000 deaths and counting. California has confirmed 374,000 cases and 7,613 deaths. And statewide, the news has been troubling. The state, as you probably know, is on notice. Deteriorating conditions have prompted the governor to put most of the counties in the penalty box or the monitoring list. And together, those counties are home to over 90% of the state's population. And of course, most relevant for us watching this, it includes pretty much all of Southern California, including San Diego County, Orange County, including all of our district. Cases and deaths in California have increased. Records have been shattered in recent days. A new single-day death toll was recently hit. Many counties are failing the governor's standard for new cases. Hospitalizations are going up, and the reopening is rolling back. The governor has returned to stricter lockdown rules. Masks are required across the state. And thinking locally for a minute, San Diego County has confirmed 22,489 cases and 472 deaths. Over the past 2 weeks, the county has recorded 6,793 new cases, which unfortunately fails the standard set by the state for transmission. There are now 498 patients hospitalized with a confirmed or suspected case in San Diego County. Orange County has confirmed 28,309 cases and 469 deaths. So for those who have been watching us since March, the numbers in San Diego County had been higher pretty much straight through up until just a couple weeks ago when Orange County surpassed the overall number of cases and now has shot up substantially higher. Over the past 2 weeks is really the reason for that, where Orange County has recorded 12,531 cases. So again, over the past 2 weeks, 12,531 in Orange County, 6,793 in San Diego County. And there are now 801 patients hospitalized with a confirmed or suspected case of COVID in San Diego County, as opposed to 498 in Orange County, although hospital capacity and ICU capacity remains acceptable pursuant to the state's averages that we need to hit. Yesterday, of course, Governor Newsom announced that schools located in counties that are on the monitoring list, which again includes all schools in San Diego and Orange counties, must not physically open for in-person instruction until their county has come off the monitoring list for 14 consecutive days. So schools in counties that have not been on the monitoring list for the prior 14 days may begin in-person instruction following public health guidelines, strong mask and physical distancing requirements, and regular testing and dedicated contact tracing. The state has set aside $5.3 billion in additional funding to support distance learning, and they've set requirements to ensure schools provide rigorous and grade-appropriate instruction. And look, with 2 young children at home, this news was very significant for my family, as I'm sure it was for many of your families. And the best thing we can do to get our schools back open is actually pretty simple. It's to get our counties, San Diego and Orange counties, off of this monitoring list. The best way we can do that is to follow the steps we know will control the spread of this virus, wearing our masks, socially distancing, prioritizing outdoor venues over indoor spaces, keeping hands away from our face, washing our hands regularly, and staying at home whenever it's practical to do so. And I'm going to continue to do everything I know to do to help our district and our country through the public health crisis and the economic crisis that we are facing. And as I've said week after week after week now, for 32 of these, I continue to believe we cannot have a healthy economy unless we have healthy people. And that will be my objective, and I hope the objective of the Congress. As I have mentioned in our past virtual town halls, we have now passed in Congress 4 bipartisan bills to deal with COVID-19, the first of which was back at the beginning of March, $8 billion for the development of a vaccine. That work continues, and I'm very encouraged by that. I think a lot of the early funding that we allocated in the Congress has helped that effort proceed, and I'm particularly grateful for our local companies that are involved in the development of the vaccine, as well as development of diagnostics and therapeutics that have helped to ease at least some of these concerns. On March 18th, we passed the Families First bill. That was another $200 billion. That went to emergency sick leave. It went to nutrition assistance, Medicaid support. And then we realized we needed more. And at the end of March, we passed the CARES Act, $2.2 trillion. You're all probably familiar with it by now. And it was very comprehensive. It included the first tranche of funds for the Paycheck Protection Program. It included a great deal of money for healthcare, for testing, and a mandate that eventually the administration develop a national testing strategy. We're still waiting for the administration to develop a national testing strategy, by the way, and here we are months later. We passed in the House now 2 months ago, the HEROES Act, another $3 trillion bill, comprehensive in scope, that would really be of great help to so many Americans during this crisis. $875 billion for state, local, territorial, and tribal government, of which $300 million would come to the 49th district alone. $100 billion for low-income renters. We now see very grave concern with regard to potential mortgage delinquencies, potential renters not able to pay their rent. I mean, we're just beginning to see this, and as the expanded unemployment insurance is set to expire at the end of the month, along with the Paycheck Protection Program application coming to an end on August 8th, and the other forbearance provisions in the CARES Act coming to an end as well. This is all of a very significant concern to me, that people aren't going to be able to pay their rent, people aren't going to be able to pay their mortgage. We included hazard pay for frontline workers. We included $25 billion, a lifeline for the U.S. Postal Service, so important. And I didn't support every word of the HEROES Act, 1,800 pages, nor do I expect every word to be supported by the Republican senators who are now deliberating and creating their own bill. But I do expect them to act. It's been far too long, 2 months. We've had nearly 50,000 Americans that have died in the 2 months since we passed the HEROES Act. Simply unacceptable. And we cannot take our foot off the gas. We know that this economic crisis continues. We know that this health crisis continues. So in the absence of any action from McConnell, I've been trying to push for certain provisions in the HEROES Act to move forward. Specifically, I mentioned the Postal Service, and I led a bipartisan letter of 137 of my colleagues calling for that $25 billion lifeline for our U.S. Postal Service. Over 630,000 Americans work at USPS, including over 100,000 veterans. And we cannot allow for 48% of the world's mail to go undelivered. I'm deeply concerned by what I'm seeing at the U.S. Postal Service and the recent Trump appointee that was put in there, who really doesn't seem to have the best interests at heart. And you're also probably familiar, as I mentioned, the Paycheck Protection Program. We initially put $320 billion in. We put $350 billion in, put another tranche of funds, so $670 billion program. It's been far from perfect. A lot of companies receive funds that perhaps didn't need the money, but according to SBA, there actually is some data now And according to their data, 20,456 small businesses in our congressional district alone benefited from the PPP program, directly or indirectly supporting 241,446 employees. And that was more than $613 million in federal stimulus funding for our district. And look, I'm thrilled that so many businesses in our district were assisted. I do remain very concerned with how some of these funds were distributed, and particularly, we've got to continue to push for better transparency and more oversight, particularly if we're talking about automatic forgiveness of loans. We have to demand oversight, accountability of how those funds were spent in the first place. And look, we have more than 139,000 people tragically dead as a result of COVID-19. There's no sign of this virus really coming to a halt anytime soon. States in the West, states in the Southeast, we see rising case numbers. State and local budgets are continuing to collapse. Tens of millions are still out of work. And we've got to continue robust action. The virus is not taking a pause, and we must not take a pause either. So now is no time for us to take our foot off the gas, and I'm going to keep pushing for major provisions of the HEROES Act to be included in the comprehensive bill that will be completed later this month. And I leave tomorrow for Washington, D.C., and we're going to get that bill done. I will stay in Washington until we get that bill done. Also very troubling to me is in the middle of this health crisis, there are those actively trying to dismantle the Affordable Care Act. And this is at a time where families need affordable health care more than ever. And the administration is actively trying to strip protections from those with pre-existing conditions and take coverage away from millions who rely on the ACA, including over 47,000 in the 49th Congressional District that rely on the Affordable Care Act. And we know how many Americans have turned to the Affordable Care Act because they've lost their employer-sponsored health care as a result of this pandemic. So now is no time to be stripping away healthcare coverage from the American people. There's so much more to discuss with regard to COVID-19. I'm very grateful that we've got really a local expert in Dr. Garfien, and I'd like to turn it over to you now, Dr. Garfien, for your opening statement on COVID-19. Thanks again for being here.
Hi, Mike. I'm happy to be back again, as always. I just hope that the information that I bring is useful to people and that they're putting that information to good use to protect our community. I know that a big issue that's on a lot of people's minds right now is getting our kids back to school. You and I have had lots of discussions about that, and unfortunately I don't have all the answers, but I thought what I could do is sort of talk a little bit about what is going on and try to help people to understand a bit more about what the issues are and what people are working on to make sure that we can get our kids back in school.
And Richard, if I could ask you to get a little closer to the microphone, I'm having a little bit of a hard time hearing you.
Yeah, you bet. Right. I'll speak
there you
up. Go. All right. So I think that what we all realize is that there's many reasons why we want to get our kids back into school. Obviously, we want our kids to get the best education they can, and we think that works best in the classroom. Although we're learning a lot about remote teaching and some of the things that have come out of this experience, I think will stick with us even after the pandemic is over. And my wife happens to be one of those teachers who is learning to become an online expert in the Del Mar City School District. They're actually training teachers to specifically teach online. And I think there's other districts that are doing the same. And I think it's important that we continue that. And I'm glad to hear that that's happening. Also, I think that, having had kids of my own, I realized that social connection to other kids is really important in terms of their social and emotional development, and so we don't want to deprive kids of that either. Another big issue, obviously, is daycare for the parents who need to get to work, and so school provides that opportunity for parents to get away from the household so that they can go to work. And maybe more importantly is that many children in our district rely on school lunch programs for food. And without going to school, many kids are going hungry, and I think that's important. But maybe there's other ways that we can address some of those things, such as daycare and school lunch. So if we can't do it in the school environment safely, maybe there's other ways that could be addressed. But those are all the reasons why we want our kids to go back to school. But there's reasons why they maybe can't go back to school right now, and that's because there are definitely harms to kids going back, and that includes things like, the fact that symptoms are rare in children, but they can be serious. There are conditions that kids have ended up with that are COVID related that have caused deaths in children, and that's really tragic. So we don't want that to happen to anybody's children. Also, children can be asymptomatic carriers, and they can infect vulnerable individuals. So kids who live with elderly parents or even grandparents, and they come home from school, the children might not be sick, but they can expose other people in the household who are highly vulnerable and susceptible to serious COVID disease. We need to think about them as well. We also know that infected children are less likely to practice prevention measures, making them more likely to become super spreaders. The kids don't necessarily wear masks correctly or understand that they have an infectious disease, and maybe exposing other people unknowingly to disease, and can actually spread the disease a lot faster than adults who might be practicing safer behaviors. And then, Jeremy, if you could throw up that first slide, I just want to also mention that teachers may become infected, and there's many teachers that are in high-risk groups. This slide from the Kaiser Family Foundation used data from a couple of years ago showing how many teachers fall into that high-risk category for being susceptible to severe COVID disease. And it shows that 1 in 4 of our teachers are in that group. And so if we expect our teachers to go back and teach our kids, we have to think about what are we doing to protect them as well. So that's sort of the why should we go back to school, and why is it hard to go back to school. So let's talk a little bit about what are some of the things that we need to do if we are going to put our kids back in the classroom setting. Obviously physical distancing is going to be important, and that is harder to do in a classroom setting. Schools tend to be very crowded, and so we might need to come up with some plans for having smaller class sizes or splitting the day so that we have fewer kids on campus at any one time. We also would want the students and the teachers and the staff at the schools to be wearing masks and to be separated by distance and other barriers to try to prevent transmission. And we also have to think about the ventilation, things that schools have been considering. And I did some looking online, and there's actually quite a few resources that are available, both nationally, put out by the education systems themselves. There's a website called EdSource that has lists of resources and plans for every school district. I found that on their website they have guidance for Orange County as well as San Diego County, and people can look at those, and I'll give those to Ellen so she can add those to your website, Mike, and you can see what the school districts are doing to try to make the school environment safe for our kids as well as our faculty and staff. And then I had one other thought there that I thought was interesting, is that England is creating what they're calling class bubbles, which is the idea there is that we may not be able to get our students and staff and teachers completely separated, but if we can sort of put them into bubbles or pods that don't interact with other bubbles or pods, then at least if there is somebody who is infected, it sort of is self-contained. Whereas if you have kids running around the school and interacting with different grade levels and different classes, then you're more likely to have a larger outbreak. And I thought that was a novel idea that maybe we can employ. I know a lot of us do that with our family pods. We sort of stay within our pods, and that way, hopefully, we're not exposing each other or getting infected. But if somebody does get infected, at least we're not spreading it to the rest of the community. And I think that might work in schools as well. So I'm sorry I don't have all the answers. Maybe I raised more questions, but I just want to give people the sense that there is a lot of work being done by a lot of really smart people, including the educators, the parents, the school districts, the superintendents. And if you're concerned about what's happening, talk to your local school board, talk to the superintendent, talk to the teachers and the principals, find out what their plan is and see what you can do to help out to make that happen.
Well, you're one of those very smart people working hard right now, Richard, and we're very grateful to you for all that you do, and thank you for that overview. Before we get to your questions, I want to shift gears now and talk a bit about environmental policy. And many of you know I've been a clean energy advocate for many years. Very fortunate to sit on both the House Select Committee on the Climate Crisis and the House Natural Resources Committee. And I also serve within the House Natural Resources Committee, the Water, Oceans, and Wildlife Subcommittee, and the Energy and Mineral Resources Subcommittee. Turning to the Select Committee for Climate, on June 30, we released our Climate Crisis Action Plan on how to dramatically reduce our nation's greenhouse gas emissions and also create a huge amount of economic growth. The report is more than 500 pages, so you can read it. If you're really interested, you can read the entire thing. If you go to climatecrisis.house.gov, you can find that report. It is the result of more than 17 hearings, 700 responses to a public request for information, and over 1,000 members. It includes specific proposals that will set the United States on the path to achieve net zero carbon pollution by at least 2050, save over 60,000 lives per year due to reduced air pollution, and save nearly $8 trillion by 2050, not including the cost of energy savings. So I'm very thrilled about this report. 7 of my bills made it into the report, including solutions that will grow our economy, put Americans back to resilient, and protect public health. Vox, the website, excellent website, Vox, recently called our action plan, and I quote, "the most detailed and well thought out plan for addressing climate change that has ever been a part of U.S. politics, an extraordinary synthesis of expertise from social and scientific fields, written by people deeply familiar with government, the levers of power, and existing policy." I was very proud to help shape this effort, and I hope you have the opportunity at least to read the summary by going to climatecrisis.house.gov. Next, I'd like to talk about the Great American Outdoors Act, something that I have championed in the House that I am hopeful will soon become law. In a moment of bipartisanship, these days maybe rare bipartisanship when it comes to environmental policy, Democrats and Republicans in the Senate voted 73 to 25 to pass the Great American Outdoors Act, a funding bill that one senator called the single greatest conservation achievement in generations. The act creates a fund to finally alleviate billions of dollars in backlog and delayed maintenance projects at America's national parks and our public lands. And as somebody who was taken to the parks years ago by my family, I hope to be able to take my kids and grandkids someday to our wonderful national parks. 70% of the fund's contents will go to the National Park Service or projects in America's national parks, encompassing over 400 places of historic, recreational, and scientific importance, from the Grand Canyon to Yellowstone. Another 15% will go to the Forest Service for maintenance on public lands, and 5% will be given to the Bureau of Indian Education, the Bureau of Land Management, and the Fish and Wildlife Service. And the delaying of repairs and maintenance on roads, bridges, restrooms, campgrounds, and visitor centers in our national parks has been mounting for years, and we're finally going to address it. I'm very proud of that. Secondly, this bill would provide permanent funding for the Land and Water Conservation Fund, also known as LWCF. And why is that so important? Well, in addition to our national parks, the LWCF helps over 40,000 California. In fact, California's parks, beaches, and public lands have benefited from $2.5 billion from the LWCF over the past half century. And this new law, the Great American Outdoors Act, would reauthorize LWCF to the tune of $900 million each year. So I'm very excited to get back to Washington to vote, in addition to helping with this 5th pandemic bill, for the Great American Outdoors, and I'm very, very pleased with how things are going. In addition to that, a few months ago, we were able to help secure $300 million in the U.S.-Mexico-Canada trade agreement to address the problem of pollution at the border in the Tijuana River Valley. And we're now working closely with the EPA and other stakeholders to ensure that that money gets to the best projects as fast as it possibly can. EPA and the administration has said they need about 10 months to study the myriad of projects that we could do there, but we need to get that done as soon as possible. And if you saw maybe about 4 or 5 weeks ago, 60 Minutes on the Tijuana River Valley, and if you haven't seen it, I hope you check it out. And finally, I was very proud that we released our new report. The San Onofre Task Force released this report, the SONGS Task Force report, and it's a great piece of work. It has 30, and we have boiled it down for the federal side, continues to be chaired by the former head of the Nuclear Regulatory Commission, who we had on one of our town halls recently, along with a retired Navy admiral, former Navy mayor of San Diego. So I've been very concerned about San Onofre for a long time, and as I've said, the waste that's still there is really the symptom of a bigger problem. The bigger problem is we lack a comprehensive strategy to deal with spent nuclear fuel throughout the United States. So we'll be looking to address that as well. With that, I'd like to turn it over to, again, a great friend and a true environmental champion, Mike Young of the California League of Conservation Voters. Mike, great to have you.
Thanks for having me. And that's quite a nice honor to call me an environmental champion from somebody who I know is absolutely an environmental champion. We're really excited about the vote that's coming up this week, especially with the Great American Outdoors Act. A lot of the things that you've actually been talking about are really exciting, and literally would not have happened without leaders such as yourself, who've been really fighting in a bipartisan way to make sure that we can have a big success like this. I think we've been listening really recently to Dr. Garfein, and obviously I think we're all experiencing COVID in a very unique way, and we're experiencing it and we're talking about it in a way that doesn't actually address how intersectional this actually the disease actually is with environmental issues and the priorities that we've been pushing. Right now, I don't know about you. I wish I were in at the beach that you see out there and go hiking, go out to nature, because you just can't stay indoors. It's driving people stir crazy. But it's also just a great way to relax and when done safely with social distancing, it's a good way to get out and enjoy and appreciate this. So Congress's recognition that's coming, that the Land and Water Conservation Act, the Great American Outdoors Act, everything that's happening here is a big, in part, I think, a recognition that this is something that the country needs right now, and it's really helpful and really powerful. When we talked about the Land and Water Conservation Fund, for instance, it's not just a concept of something that's happening across the country. We're talking about places that people go to all the time. Anza Borrego Desert is a beneficiary. Actually, San Onofre Surfing Beach is actually a beneficiary of the Land and Water Conservation Fund. These aren't arbitrary places. These are the places that we go to relax, to enjoy, and spend time with our families. And I think also challenging and trying time. We are also living much care for environmental progress or environmental priorities. And that's been something that we've been heavily concerned about. The things that they've been doing to roll back some of our environmental laws, unfortunately, there have been some big ones that they've been announcing in the last week alone, have made the last 3.5 years incredibly trying. I think a lot of people don't realize that California has more lawsuits on the environment than any other lawsuit with this current administration. They're at something like 7. I think I lost count after 72. But 72, more than 72 lawsuits suing on all the different ways that they've been trying to roll back all of our different environmental laws, from water quality to air quality. And again, this is happening at a time, especially with air quality rollbacks, at a time when we're dealing with a respiratory disease. So the communities that are already dealing with pollution in air pollution in their communities have it even worse, because they're dealing with the disease that only just makes it worse when the two are combined together. We're definitely looking for a thoughtful approach. I think we're optimistic that there's strong environmental leadership that exists, including yourself. And we're seeing some momentum really building for environmental priorities. when I think largely about the select committee's work. And thank you again. I think back to when you first got elected and you actually had talked to me and said, I have this idea, this vision of what I want to accomplish. And before my first term is over, I want to have and you said this to me, and people are going to say, oh, this is made up. This is actually true. He actually said,
we didn't rehearse this, by the way, so I have no idea what Mike is about to say here.
well, you came to me and you asked me, and you're like, and you told me what I thought about climate work, and I said, I don't think in Congress there's been a comprehensive plan since Waxman Markey back in 2010. And you actually said to me, you're like, I think what I want for my goal and what I think we need to be doing now is having a comprehensive plan for how to tackle the climate, and that's what I want to do in my first year. And when the report came out on the 30th, it's you've already done so much, but you actually accomplished one of those big things. And what's important about accomplishing that big thing, about creating that roadmap, is that now that we have it, we need to implement it. Have the information that we need, and now we need to make it possible. But we're very excited, and actually without that roadmap, we would often be lost. Unfortunately, policy is a lot like this reference in South Park with the underpants gnomes, who often they would come in and they had this 3-part strategy. Step 1 is steal underpants, and step 2 was something, and step 3 was profit. And nobody could ever figure out what was step 2. And I think our environmental problems, especially tackling the climate crisis, there's a lot of questions on what is step 2, what does that look like, and now we know. And that's largely thanks to the work that the committee has done. And you've done really Yeoman's work, and we're really excited about it. So thank you.
Well, I'm very grateful for that, Mike. And I think that it's all about what happens in the next 100 or so days in terms of getting out the vote in the November election, in terms of what happens in the Oval Office and in the Senate. And I think the key here is that we've demonstrated in California that saying that somehow protecting the environment or advancing our clean energy future will harm the economy is really a false choice. Where we know from the experience in California, pre-pandemic, of course, we've been hit like everyone else with the pandemic, but we've created the clean energy jobs of the future. We've grown our economy. We had very excellent per capita economic growth before the pandemic, and we did it in California. We can do it elsewhere as well. And I'm very confident that we can, and that we've learned how we can accelerate the transition to a more sustainable future. I hope that people do take the time to report, just as they take the time to read our San Onofre work as well. These are complex, challenging issues. They're going to require multifaceted, complex solutions. They don't always fit on a bumper sticker. But the importance is in the details and in the work that we've done. And I think it'll stand the test of time. And I hope in a couple of years that we'll be able to look back and know that a lot of that ground, that foundation that was set by the 116th Congress, a lot of that can actually bear fruit in the 117th and beyond. So I wanted to ask you, Mike, I wanted to specifically dig in a bit, and then I want to get to our audience questions. But can you tell our audience how CLCD is different from other environmental groups?
Yeah, thanks for that question. And of course, we love our fellow environmental organizations. There's a great network of us. But CLCD is specifically focused on changing the way that we make change. We've believed for a long time that this demonstrates what happens when you have the will and the right people there who can make the decisions, that can push us to create the policies and push for those policies that we need to actually solve this crisis. Unfortunately, there's obviously a lot of roadblocks that are there. There are people who don't want to tackle the climate crisis for often, unfortunately, very self-serving reasons. But that they're emboldened by the fact that they have a system of inertia. So we'll pass those key environmental bills that we need to pass and to move the environmental movement forward.
And it's not surprising that given everything happening with COVID, Trump is rolling back environmental laws left and right. And we've seen a number of attacks on the environment, frankly, undermining decades of bipartisan work towards clean air and clean water. What are some of the biggest seem that are not getting the attention that they deserve?
Well, I'd start with one that I just saw completely lost in the headlines, and there are maybe one or two articles that talked about it. So the National Environmental Policy Act is a huge piece of legislation. This is essentially what makes sure that we understand what the environmental impacts are for any big project that gets put together. This has been the tool to make sure that we're not building oil pipelines near schools, right? Some very good common sense reform. Unfortunately, the current administration has appointed oil lobbyists to run the Environmental Protection Agency. And they've been spending a lot of diligent time trying to undo and weaken these laws to make it so that you can't actually properly study the impacts of any projects, or in some cases, not be able for a community to have any input whatsoever to complain about a project. So what could that look like for your average person? If there's expansion to a freeway, for instance, the report says, well, maybe you might study the impacts of the freeway, maybe, but let's not study the impact of what would happen when people are actually driving on the freeway and your house is right next to that freeway, right? So it's some of these very common sense, very logical, important laws are there because, or our policies are there because we were able to carefully study it and make sure that we understand EPA or the COVID as an excuse to completely relax environmental enforcement under the EPA. It sounds big, it sounds crazy, and that's actually what's happened. In fact, in the latest report, 350 facilities, including oil refineries and oil rigs across the country, decided we don't need to report what kind of pollution that we're setting into the air, to the water, what kind of impact we're having on the community. We don't have to report any of that because the EPA says that we don't have to.
Wow.
I mean, we've never dealt with anything quite like this before. So like such blatant disregard for environmental laws. And of course, that also combines with the current administration's attacks on our ability to have cleaner cars. They've been trying to roll back California's, the Obama are saving money at the pump. And the administration didn't even do this at the behest of car manufacturers. They just did it actually at the request of car manufacturers telling them not to do this. They've been trying to roll back those clean air standards and those clean vehicle standards. And more importantly, they're trying to undermine California's ability to actually have requirements for those cars and for those standards. So there's really nothing left unturned for them. And no one's quite sure what their interest is, except the fact that they are currently now run almost entirely by former.
California got its waiver from the Federal Clean Air Act. Ronald Reagan was the governor. When the EPA was created, the Clean Air Act, Clean Water Act, NEPA, when all that was created, Richard Nixon was the president. Broad bipartisan support in House and Senate for many of those laws. When cap and trade was developed to deal with acid rain, George H.W. Bush was president. And when California decided to go further in terms of reducing its greenhouse gas emissions, Arnold Schwarzenegger was governor. So we've had a long line of Republicans, actually, that have worked with Democrats. And that was basically the case up until the current occupant of the White House, who put fossil fuel lobbyists in charge. It wasn't that they're too close to the fossil fuel industry. It's that they actually are the fossil fuel industry and just follow the money. We see $8,200 million plus spent by the fossil fuel industry on federal elections since Citizens United. They could have invested in research and innovation. Instead, they invested in politicians. And it's a shame that we're now seeing the wholesale undermining of decades of bipartisan environmental progress. And we've got to do better. So last question for you. CLCD is focusing on some things that are not, naturally thought of directly related to the environment, but perhaps you can explain why they are. Things like protecting our democracy and the census and gerrymandering. You want to talk about some of that work?
Yeah, so this is something I think everyone should be paying closer attention to. And when we talk about someone as great as John Lewis, he spent his life really focusing on addressing these types of issues to make sure that there's voter access. our democracy is important, and one thing that we should know is that the environment especially is something that's widely popular by bipartisan majorities across the country. But the representation that you have doesn't necessarily reflect that. I think about this particular seat where we used to have, for decades, one of the worst environmental votes and a climate denier. And now we have literally, and this was not said to me, this was said to me, I didn't just come up with this on my own, the person who's considered the strongest environmental freshman in Congress today. It's the exact same district, but representation is incredibly different and incredibly important. And that's because things like the census and things like redistricting make it so that they ensure communities actually have the ability to vote and choose the people that they want. So much of gerrymandering, so much of the redistricting process, so much of the census, which is all happening basically in the next year and two, and some of it's happening right now, including the census, is really about making sure that communities have that voice and have a reflection and get the resources they need. It's unfortunate now that when we look at something like only about 68% of people have filled it out in California. That's a long way to go. And so when we're creating, when we're figuring out districts, when we're trying to figure out what kind of resources California has, that's wildly inefficient compared to how much it could have and what it could really look like. And when we think about something like redistricting, that's the opportunity to make sure that the lines that we have, the district lines, are drawn towards communities and communities of interest that actually reflect the values of each community. Because the fossil fuel interest especially has spent money across the country really trying to rig the system so that the representatives of these communities, especially communities that could be very responsive to environmental concerns because they have oil refineries in them, because they have factories and plants or by the beach, they draw them in ways that are split up to make sure that they can get a fossil fuel representative voting like Donald Trump, who's in there, who does not have accountability from the Senate, and a Senate that represents 15 million fewer people than the minority of the Senate. It really demonstrates the fact that our democracy is something we cannot take for granted. Everyone deserves the right and chance to vote. And it's so important, especially for environmental interests, not because we have a special interest of trying to rig any type of system. We just want people to reflect the will that they have, because we know that protecting the environment is incredibly popular.
Well, thank you so much, Mike, for all your great work. Very grateful for you. We've got a ton of questions from our audience. I actually wanted to just very quickly address something that's happening just in the last couple of days, which is the situation in Portland, Oregon, because we got a couple of questions about it. Peter O'Brien said on Thursday night in Portland, Oregon, out-of-uniform CBP officers forcefully apprehended at least 2 citizens and stole away with them in an unmarked rental van. CBP has jurisdiction across your district. Please comment on what is being done to protect your constituents from extrajudicial secret policing. Peter, thank you for the question. I'm deeply concerned. And what I did upon seeing this is I reached out to a good friend who represents that community, Earl Blumenauer, and I asked him what we should consider next week. And I know that along with Jeff Merkley and Ron Wyden, the 2 senators from Oregon, Earl and my friend Suzanne Bonamici, another rep from Oregon, have called for investigations into these federal operatives. We're also now hearing from reporting literally in real time just before I started the town hall that the people that were being used from DHS and CBP were not properly trained. And they actually could have exacerbated what was a violent situation. So we're going to be focused on this along with everything else we just talked about next week. I don't know exactly what legislative effort or other efforts will take place, but I do know that Senators Merkley and Wyden, I'm sure, are in touch with Senator Schumer, and I'm sure also that Reps Blumenauer and Bonamici are in touch with us. Back over to COVID. And we've got a bunch of questions for you, Dr. Garfien, around schools reopening. And I will just get to the first one from Roberto in Vista, who says, I don't see how we open schools under the current conditions. Is the CDC changing their initial guidance and giving in to political pressure from the White House? And Richard, I just and you may be muted. There you go.
Yeah. Well, I switched phones. How do I sound now?
Much better.
All right. Good. Technology. It's fun. Well, I think that the CDC guidance remains grounded in the best available science, which unfortunately for the administration, it indicates that it's going to be a challenge to ensure the safety of our children, teachers, staff, and family members if schools reopen. The House Education and Labor Chairman Bobby Scott requested that the CDC requested CDC guidance for Congress. Redfield has testified on the Hill at least 4 times in the last 3 months. We need our doctors focused on the pandemic response. Notably, the Congress didn't specifically request testimony from Dr. Redfield. He just said we would like to hear from the CDC. So I think that this is a blatant attempt by the administration to avoid listening to the CDC. And so it makes it very, very difficult for the agency to put out recommendations if they're not going to be followed or even regarded by the administration. So I think, these things can sort of go back to normal pretty easily. In other communities where there's a lot of coronavirus spreading, we have to take those additional precautions. And so it's good to have guidance from the top, but it's also important to have implementation dictated from the local level.
Well, and I'll tell you, I read with great alarm the Washington Post perspective piece, editorial piece. We ran the CDC. No president ever politicized its science this way. And I'm just deeply concerned about this. And I know that a number of my colleagues are discussing appropriate next steps. I've been on some of those calls, and this is a problem administration-wide, disregard for science. We've got to follow the science, follow the evidence, and to see the CDC's recommendations belittled or disregarded because they're politically inconvenient. This is not something that we've ever seen. And since the CDC's creation, we've had broad bipartisan support for the basic premise that we want to follow the advice of epidemiologists and public health experts. Well, in the middle of a pandemic, this is not up for negotiation in my book. And we're going to fight very, very hard to maintain the integrity of the CDC at a time when it appears it's being undermined and attacked. So we can't allow that to happen. Barb in Oceanside asks, what power does Trump actually have, if any, to not fund schools if they don't reopen? And would that mostly affect students with special ed services? Well, Barb, he doesn't have the power to do a whole lot here, which is why I think a lot of those schools listened to what he had to say and decided they weren't going to do what he asked. They ultimately will make decisions based on the best interests of their own communities. And I know that's the case for all of our districts here. I've spoken with many of our superintendents multiple times about all of this. I think they were looking for clarity, and many of them are looking for resources. It will cost to reopen in the manner that the state is prescribing many millions of dollars for each school district. One superintendent I spoke to, if they could do it absolutely perfect the way they would want with the ratios and the facilities and the additional supplies, we're talking about tens of millions of dollars. They don't have that money. They don't have those supplies unless they've very recently been provided by the state. So it's sort of like Andrew Cuomo, when Andrew Cuomo was saying how all the states were being pitted against each other for supplies and the federal funding wasn't getting to New York at the time. He said, if you're going to pass the buck, you better pass the bucks. So if we're going to expect these states to move forward and to work with our schools, we're going to expect these cities to move forward and work with our schools, we're going to expect those schools to have the resources, then we better pass what we put in the HEROES Act, which is more funding for state and local government, more funding for our schools to help them reopen. And absent that, it's impossible for that to be a sustainable model. When you look at what is being laid out by California and all the things that our schools are going to have to do, and that assumes that we get San Diego and Orange counties out of the penalty box, which is obviously the first priority. to meet that state criteria. Next question from Veronica in San Juan Capistrano, also school-related question. What can teachers do to get someone to listen about not teaching face-to-face so that we don't risk the lives of our students? Additional comments come in from Helen and Vista, who says, I'm a teacher worried about starting back if testing is not readily available. And from Anne in Oceanside, who says, I'm a teacher. We do not have the money to put in all the safety measures. We have no room to social distance. Every teacher I know is terrified. First thing I can tell you is that I am listening. I have heard from so many teachers, and I'm so grateful for the work that you do for our students, for our communities. We've got to make sure that we keep you safe, that we keep everybody who works at schools safe, and that we keep our children and our families safe. Again, no healthy economy without healthy people. Very simple. So if we're going to demand that schools do these things and have these new requirements, we better help them with the resources they need to get there. Dr. Garfield, anything to add?
Yeah, you know I've always got something to add, Mike.
And as the husband of a teacher, you've got to weigh in on this one.
You know, I really appreciate having Susan to bounce these ideas off of, because she really gives me a lot of insight from her and her peers about some of these issues from the perspective of the teachers. Recommend establishing and continuing communication with local, state authorities to determine the current disease levels and control measures in your community. So it's as I was saying before, you want to know whether or not your community has coronavirus circulating, because that can have an impact on what the activities are that are taking place in the schools. And so Governor Newsom on Friday announced new guidance for when schools can reopen for in-person instruction. Until counties have been off of that list for at least 14 days, the schools should not be able to reopen. And he's saying this because those schools are at higher risk for being sort of epicenters for transmission. So right now that's our situation, and that's the governor's stance, and so it's up to our communities to sort of work to try to make it feasible for our kids to go back to school. And one of them is what I keep harping on before, town halls, which is we have to do our part to prevent transmission, and we do that by wearing masks right now. Some other things that the school districts can be doing are things like establishing a written worksite-specific COVID prevention plan at every facility. External community organizations can utilize those facilities. So a lot of schools are used for things besides just education. There's a lot of community organizations that use those spaces as well, and we have to consider them and whether or not they can share that space safely. The schools need to develop a plan for the possibility of repeated closures of classes. You know, if everything's going along smoothly and then all of a sudden you start seeing cases among the kids in school, it might be necessary to shut things down again, at least temporarily, until that situation can get under control so we don't end up with a much bigger problem. Also, to develop a plan to further support students with access and functional needs. You know, there's a lot of kids that maybe can't wear a mask or don't even have the ability to wash their hands. They may have cognitive or other situations that make it hard for them to understand what the rules are. And so we have to make sure that those children are being accommodated as well. And so what this brings me to then is, finally, the schools should review California Department of Public Health guidance on how to, wear masks safely and how to use it in this situation. So I just want to sort of end this by saying, what's the role of the parents? So we expect the school district to do all these things to help to bring our kids back, but what can we do as a community and as parents to help with this process? So first off, be aware that the schools might need to close again. It's not ideal, it's inconvenient. We know that it's not the best thing for our children, but it might be necessary. So rather than fighting that, we sort of have to understand that might be a necessary evil, and we need to be thinking about what are we going to do if that happens. So have a backup plan. Also, be aware that children could be infected and not show symptoms. So we need to protect family members. If you've got kids that are going back to school, but you also have an elderly family member living with you, you really have to think about how are you going to protect that older family member in case Johnny comes home from school infected and doesn't know it? The other thing is, don't send your children to school if they're sick or if they are known to have come in contact with a case. So we want to protect the school and all the other children in the school as well. Also, talk to your children about what's going on and encourage healthy practices. You know, they're going to be told to do things in school. Help them to understand what it is that they're doing. Help them to understand why it's important to stand in lines and to stay separate and to wear a mask and to wash their hands and to do the things that the teachers are going to be asking them to do. We really need to support them in this effort. And then finally, model healthy practices when you're at home and out in public. So if the parents are wearing a mask when they're going out in public to go shopping or pick up food from the grocery store or whatever, that really sends a positive message to the kids, and it will help to reinforce those behaviors in school. So we all have our part to play, and hopefully we can get that done.
Thank you for that excellent answer, Richard, and thanks again to your better half for all the work for our children. Charles in Del Mar has an environmental question, Mike, so get ready. He says, on Wednesday, the president announced he was changing the 50-year-old Nixon-era conservation law called the National Environmental Policy Act. News organizations, including National Geographic, listed 100 environmental rules that this Republican administration has rolled back. Why is Congress not combating this? What can you personally do? That the National Environmental Policy Act was passed on July 10th, 1969 in the Senate unanimously. It then moved to the House, where September 23rd, 1969, it passed 372 to 15. You can't get anything to pass the House 372 to 15. So you had all Republicans, all Democrats, and a few holdouts that voted for it. And then you had President Nixon sign it January 1 of 1970. This has been the bedrock environmental law in the United States for 5 decades. And it is incomprehensible to me that this administration, you know, other administrations, other agency heads, they wanted to take issue with this part or that part of NEPA. Okay, but don't gut the entire law. Don't gut all of the National Environmental Policy Act. Don't gut the Clean Air Act, the Clean Water Act, the Endangered Species Act. When does it stop? And this administration would really want no environmental law if they could have their way. And it's deeply offensive. So what we say is then we're going to roll back a lot of these more draconian environmental policies to more sanity, to where that bipartisan consensus had been before this president.
Yeah, I think that's right. I mean, the biggest thing that the Congress can do is right now is look at it, review it, and change and cancel or change out rules that might have been passed under the current administration. A lot of what they're trying to do, including what's happening with NEPA, the National Environmental Policy Act, they're trying to do now so that it actually falls outside of the range of the Congressional Review Act. But that said, you know, the most important thing, I think the congressman said it quite well, is getting somebody and working the next 100 days to get somebody who will actually be responsive to the environment. Because the reality is a lot of the things that are happening now can actually decently be undone if you have a new administration. It took them literally 3 hours before every word with the every mention of climate change was removed from their own website. It was a night and day difference. It wasn't even a night. It wasn't even a day. It just happened very quickly. And so what based in the administration fairly quickly. And so getting the right person in would make a big difference. The other big thing that Congress can do is actually fight against the awful appointments that they're pushing. And right now the administration is trying to push William Pentley to roll back our public lands law.
Well, and the other thing we know is that the administration, in the 2 or 3 weeks after the November election, whether they win or lose, intends to, at least if the reporting is accurate, announce new offshore drilling plans in Florida and California. I have had hundreds of town hall, house party style meetings. I've yet to find a single person, Republican, Democrat, anybody that wants to see drill rigs off our beautiful Pacific Ocean. And it's unconscionable that they would defy the will of the residents of California. In fact, I asked the Interior Secretary face to face, what confidence can you give me that you will listen to the will of Californians when it comes to offshore drilling? And he said that he would only follow the law, as he understands it gives him the authority to do as he chooses and override the will of Californians. I think we'll be fighting every step of the way if they propose drilling off our coast, and we already have and will continue to. Here's a question for you, Dr. Garfien, from Sarah in Dana Point. Sarah says, I have noticed that some people wear their masks covering their mouth only, leaving the nose.
I'm sure lots of people do. Is that people are just not wearing their masks correctly. So the Moffitt Cancer Center actually had a really nice website that talks about the mistakes that people make in wearing masks. And this is important not just for coronavirus, but for cancer patients. Many of them are on immunosuppressive drugs, and they're very website had a few nice tips there. And so there's 4 critical mistakes that they 5 actually that they refer to. One is that the mask only covers your mouth. In other words, in response, it does, as the caller pointed out, the mask is not covering up their nose, and that's a problem because we mostly breathe through our noses, and as we breathe, we can be expelling viral particles from our nose, and so the mask really isn't doing as much good for protecting others. Plus, if we sneeze, that's where all the droplets come out of. So it's important to wear the mask up over the nose, and not just the tip, but get it up across the bridge of the nose. And most masks have a little wire in there that could be bent and shaped to our face. And if you shape it nicely and tightly, then the air goes to the side or out the mask instead of coming up and fogging up our glasses. So if you see your mask if your glasses are being fogged up, tighten up that little nose bridge. The second mistake is that the mask is too loose. If you're wearing a surgical mask or a cloth mask, make sure that it fits snugly and doesn't have like the big puff out on the sides, because if you breathe and you cough, it goes out the sides, so somebody standing next to you could be exposed, and then the mask isn't doing what it's supposed to be doing. Also, if you have facial hair, you might want to trim some of that facial hair to get a better fit of the mask. The idea is that you want it to fit snugly all the way around the face so that you're breathing through the mask as opposed to out all the ventilation holes on the side. The third mistake is that you keep touching your mask. Now, this is a big one because I think people tend to pull down the mask when when their nose itches or they need to take a drink of something, and so there's sort of this constant touching of the mask. Is that if you're breathing through a mask and if you're around other people that are infected, the mask is a filter, and it's attracting viral particles. Those viral particles are sitting on the outside of the mask, and vice versa. If you're infected and the particles are on the inside, when you touch the mask, now you're contaminating your hands. Or it's possible that if you have some contamination on your hands from somewhere else and you touch your mask, you're going to be contaminating your mask and then putting that right next to your face. So the idea is try to avoid touching your mask, and if you do touch your mask, the best thing to do is to sort of grab it by the ties or the ear straps and not the mask itself, and then wash your hands after you're done touching your mask because that mask may have been contaminated. The other thing that we see a lot of people do, and I know this is going to be difficult for a lot of people to handle, is especially the people that have the mask that sort of pulls up like a turtleneck. When they're not wearing it, they pull it down. When they need it, they pull it up. I'd rather see people wearing something to protect those around them, but I think you just have to be really conscious of the fact that that mask is being contaminated potentially with virus, and it's hazardous material at that point, and you really should be very careful about how you handle it. Fourth is the fourth mistake is taking your mask off wrong, which is what I just sort of mentioned. The idea there is that if the mask is contaminated, you want to grab it by the straps and then take it off carefully and then discard it, or if it's a cloth mask, put it into the laundry and wash it as normal. And then wash your hands afterwards. And then finally, the fifth mistake is that the masks aren't being properly cleaned. If it's a surgical mask or a mask that isn't meant to be washed, then when they get soiled or dirty, they should be discarded, and they can be thrown in the trash, but make sure you're putting them in the trash safely. But if it's a cloth mask, then frequently they should be washed in the laundry. You can just put it in the regular wash. The hotter the water and the drier, the better for killing virus, but this virus is very susceptible to washing, so just throwing it in the wash with your regular clothes will work just fine. And so going back to the original question of what do we do about those people that are not wearing their mask correctly, you know, it's really hard to tell somebody to wear their mask correctly. I get that. We don't want to start fights with people. If you really are uncomfortable with the way that somebody's wearing their mask, step away. Get that 6-foot distance away from them because their mask isn't doing any good. If they're preparing your food, you may not want to eat that food. There isn't a lot of risk from eating food that we've seen, but just the same, if a person's back there who's sick with anything, whether it's the coronavirus or a cold or the flu or anything else, you probably don't want them preparing your food if they're not being careful with their hygiene.
Thank you, Doctor. We've got several more medical questions. I want to get through as many as we can with the time that we have, so I'm going to do a bit of rapid fire here.
All right.
Aaron in La Jolla asks, is it safe to volunteer at food banks if you're over the age?
For me to say whether or not it's safe for you, but Jeremy, if you could put up that second slide I have. The point here is that as you can see on that top right figure, the older you are, the higher the risk is of becoming hospitalized if you get infected with coronavirus. So 65 and older, you're definitely in that higher risk group. And then also 8 out of 10 coronavirus cases that are hospitalized are over the age of 65. So you're in that high-risk group. I think we'd want to be really careful there with your potential exposure. So then the question is, how do you protect yourself? Again, wear a mask when you're there. The mask is really supposed to be wash your hands and use hand sanitizer frequently. Avoid touching your eyes, nose, and mouth, and maintain that physical distance. Also assess the environment. When you go there, are other people all being really diligent about wearing their masks? If they are, that's definitely an advantage. Also, are you standing close to other people or not? And then finally, maybe there's a chance that there's something you could do where you're not having direct contact with the clients. Maybe you're helping to load bags or doing something where you're not necessarily working close to other people. And if you really can't do that, then find other ways to help. You can hold them, but I think it's important that you be safe too.
Adele in Solana Beach asks, how long is an asymptomatic carrier contagious? Many people self-quarantine for 2 weeks after a possible...
Sufficient for quarantine. A study that, the average incubation period is about 5 days, and after about 8 days after the onset of symptoms, the amount of virus that people are shedding declines, and in studies that have looked at so 14 days is adequate, and that's what the standard guidelines are.
Next, from Whitney in Carlsbad, if you've had COVID but were asymptomatic, what kind of health impacts could you experience in the future?
Well, that's a really tough one because this is a brand new virus. It hasn't been around long enough for us to really say virus, which can affect the neurologic system, the lungs, the heart, the vasculature. Whether or not these impacts will affect people long term, maybe making them more susceptible to things like strokes or heart disease as they age, we don't know that yet. There does seem to be some inflammation that's taking place even among people that are asymptomatic. You might feel fine, but in a study that looked at people who were asymptomatic and did CT scans of the lungs, they did actually find that they basically had what looked like walking pneumonia, even though they had no other symptoms. So even though you might be symptomatic, there could still be some disease pathology taking place. As far as whether or not the health impacts will be long-term, we don't know that yet. But I would say if you can avoid getting coronavirus, you're better off than if you were to just say, hey, it's the flu, I can get it, and it won't matter. Okay?
Jorge in Solana Beach says, this one's tough. Says, I can't get a COVID test in San Diego County anywhere. I'm over 75 but don't have any symptoms. What happened? San Diego County used to offer free tests for people like me. I visited my doctor, but she won't write a referral for me because I don't have symptoms.
Yeah, the amount of testing available is not. San Diego said that drive-through locations will remain open throughout the county, but the county will stop taking appointments starting on Monday for those without symptoms. So going forward, the priority for the Public Health Department testing will be for people in certain high-risk groups, such as healthcare workers, first responders, those with chronic medical conditions, and those living in long-term care facilities if they don't have symptoms. However, CVS and Rite Aid have open testing locations, and according to a report on NBC News, the testing is free with or without insurance. Also, according to Rite Aid's spokesman, the testing will be available for people with and without symptoms. I believe that CVS will be requiring people to have symptoms in order to get tested. So call ahead because you will need to make an appointment, and it could take a few days. And I think they're only making appointments about 4 days out. So if they don't have an appointment available, call back the next day because you might be able to get in as they open up new slots. And I think the most important thing here is that testing is important, but it's part of a bigger process, which is our contact tracing and testing process, which means that if you test positive, you should be isolated for 14 days or at least 10 days after the end of symptoms in order to make sure that you're not infecting anyone else. In addition, anybody who's a contact with somebody who is a known case of coronavirus should also be quarantined for that 14 days to see if they develop symptoms and to avoid transmitting to others. So all that you would all of a sudden not have to quarantine, because it might be that the viral level is too low, or you might you might still be in the incubation period for the infection, and so it might feel good to know what the results are, but there's a lot that we could do.
Tina in San Clemente asks, I want to stay updated on COVID-19 tests, vaccine trials, etc., but I don't know where to find reliable information. What website or news source do you recommend?
So the FDA has a frequently asked questions website. That's where you can find all the trials that are being done on drugs, vaccines, and the like for coronavirus listed, and they give some information about where they are in terms of those trials. And then there's a number of other sites like the CDC sites with FAQs, etc. And I'm going to give those to Mike's assistant to post as well. They're really great sites. There's a lot of information there. Those are probably some places I would start, and then obviously you can dig deeper as you find specific questions that you're interested in.
Dan in Encinitas says, I'm a retired physician and I stay home as much as possible, but I do venture out to get and deliver food and to go to exercise destinations. I noticed that it looks like a majority of people on coastal North County paths, sidewalks. Please comment.
Well, I'm glad Dan brought that up.
Please comment.
Well, I'm glad Dan brought that up because people really do need to understand, as Dan said, the risk while outdoors is not nil, and precautions are still necessary. Environmental factors, including the temperature, humidity, wind, ultraviolet light from the sun, and having more room to physically distance, all contribute to lowering that risk of coronavirus transmission when you're outdoors compared to indoors. But there's other factors that can also offset those reductions, and that includes physical distancing. So if you're going up and down the staircase at Grandview and you're passing other people on the stairs closer than 6 feet, there is a possibility of transmitting. Now, we typically think of needing to be in contact more than just a brief passing. Usually it's, we say 10 minutes or 15 minutes of close contact before transmission really has a chance to occur. But, you can be outside and still be within 6 feet of somebody and transmit. And so it's not impossible. So mask wearing is important. I mentioned the exposure time. Also, if you're in an outdoor environment, it may be noisy, especially if you're standing at the beach where the waves are pounding, and so you might be speaking louder and projecting your voice louder, which also transmits more or spreads more. Or you exercising with a friend, you may be jogging together. These are things that can increase the risk. So Dan, you're absolutely right. It's safer to be outdoors, but it's not no risk, and we need to continue to be vigilant in order to prevent transmission.
Finally, Lisa in Carlsbad asked,
in all 50 states, and the situation is constantly changing. So make sure before you go on your trip, you know where you're going. Is coronavirus spreading where you're going? You may want to rethink that area. Maybe Florida, this isn't the time to go to Disney World. Also, is the coronavirus spreading in your community? Because if you're coming from a high prevalence area, you could be bringing your coronavirus and spreading it to communities that don't have it. So be aware of that. Also, will you be traveling in places where you'll be within 6 feet of other people while you're traveling? It depends on where you're going and what you're doing. Can you actually physically distance? Are you going to visit somebody who's a family member who might be older, or a friend who's older, and maybe putting them at risk of exposure and serious disease? Also, do you live with somebody who may be in a vulnerable group, so that when you come back from your trip, are you going to be potentially exposing them to coronavirus? And if you are you in a situation where you can quarantine for 14 days before you interact with that person again? And then also, if you do get sick while you're traveling, these are all really important things that you want to consider. Make sure that you're washing your hands often, wearing your face masks often while you're traveling, avoid touching your eyes, nose, and mouth, avoid close contact with other people. When you go to a hotel and you check in, maybe send in one person in the family to go and check in instead of the whole family congregating in the lobby where you might be surrounded by a lot of other people. And if you're doing a road trip, try to use drive-thrus as opposed to stopping in restaurants, or even better, bring your own food so that you don't have to make those stops. I think traveling can be done safely, but it takes a little bit of extra effort, and you have to be really thoughtful about it.
well, thank you so much for answering the lightning round.
Thanks for having me. I mean, my closing thought is essentially that we didn't get to talk about it, but as we're talking about COVID, I hope everyone really thinks about November and votes carefully and thoughtfully. In California, we have the ability to vote from home or vote by mail, but as the speaker calls it, vote at home, which I really love. And we are actually working on some things to make sure that people who can't afford to, who aren't able to do so for many reasons, can also vote safely at the polling place. But we need people to be out there, to be active, and change only happens when we're all involved.
I want to thank my family for also giving me up on Saturdays. And, Mike, it's a pleasure meeting you, and I really appreciate the work that you're doing. I love the outdoors. I love to surf. And, we can't all do everything, so it's just really reassuring to know that there's somebody as smart as you and the congressmen that are working to protect our environment and make those opportunities available to all the rest of us.
Well, thank you so much. I'm so grateful to you both. I want to express again the importance, by now sort of a broken record, follow the guidelines of the CDC and our California Department of Public Health in our counties. Let's do all we can, as we said, to get out of the penalty box as soon as possible. I hope within the next 2 weeks we can do that to get the schools back on track and all the rest. I also want to thank my whole team. Ellen Montanari, who does such a great job getting all these questions from our audience, our great campaign team, Adam and Hunter, and everybody working so hard on the field side, trying to figure out how you do field while following public health guidelines in a pandemic. And of course, Jeremy, who does such a fine job now with our 32nd one of these. I'm ready for 32 more. I don't know about you guys. I'm ready. I want to thank also my family, as Richard said, for giving him up on Saturdays. I want to thank my family for giving me up 6 days a week, pretty much every week, sometimes more than that. I'll be heading out tomorrow to DC for a couple of weeks. I'll be missing them terribly, and obviously we can communicate like this, but it's not the same, particularly for Chrissy and the kids. And for me, I miss them terribly when I'm gone. Also, my in-laws, I want to send my love to you in Arizona. I know that Arizona is dealing with this crisis really at the epicenter of this, and I know you're staying safe and healthy, as well as all my extended family in Arizona and elsewhere. I also want to remind everybody watching that We do have an election in about 100 days, so if you're interested in volunteering or you'd like a yard sign or you'd like to contribute, you can do all of that at our website at mikelevin.org, mikelevin.org. Thank you all. Stay safe, stay healthy, keep fighting. As my friend John would have said, good trouble, necessary trouble. We'll see you next week. Thank you.